Hi guys, welcome to the second installment of VIP News Radio. I wanted to start this service originally to help people recovering from addiction. Having gone through it myself, it can be very, very difficult to find the right resources that fit you because everyone's pathology is different. And the things that work for other people may not work for you, or very likely will not work for you if their addiction was different. So you kind of have to hunt around until you find the exact modality that works for you and then stick to it. And then once you know you've recovered, you have to find your own ways of adhering to sobriety. Some people will say straight edge is the only way to be, which I think is the case. I've heard people say other things where, that true recovery is when you can go back to enjoying moderate or reasonable amounts of whatever the substance is. But I think true and complete recovery is the best way to go, because then it's easy. It's a very black and white approach. I would say I'm completely through the throes of my addiction, and the place I'm at now is creating a strong foundation for recovery. And for everybody, there's what's called gateway drug or gateway substance. For listeners from last week, I had my buddy Red from when I was, in vacation, as my friends suggested I refer to it as, when we were incarcerated together, both from addiction issues. His gateway is different, and his path is different. There's a very good program in Virginia called HARP. Right now it's helping addicts recover progressively, but it used to be Heroin Addiction Recovery Program. It's run by Carl Leonard, very well renowned, very respected, because very successful program. I personally don't have any experience with it. I personally never been on heroin. I thank God that that's the case. It does make it difficult for me to relate to people who've had that addiction, because I've never experienced it. I have been addicted to painkillers, pills, so there's some relationship there. But this is the story I tell people from my perspective that I heard universally once you're, thrown in with a lot of people who have had addiction issues and forcibly detained. Every single person who has had an addiction loves to talk about their favorite substance and wants to explain what they love about it. And, you can tell that it's likely that they will go back to it, and they're just biding their time. So I kind of divided it into a few different categories. There's the people who like the psychedelics, there's the people who like the uppers, and there's the people who like the painkillers. It's really the three main ones. And everybody wants to talk about their substance. Everybody wants you to try their substance. They want to talk about their stories, except for the heroin people. They all universally say, never, ever touch it. So I think that's good advice for those of us out here. There's a lot of us who never would anyways, but it's useful to know in case you have what we would call a gateway substance and would end up at parties where stuff exists. The best thing to do is to be a straight edge and not be around these things. This is why it can be so tough to hang out with people who are completely recovered, because we have no tolerance for any of it. The gateway drug that has been tough for me to give up has been beer, because I love Newcastle, brown ale, stuff like that. But there's a lot of non-alcoholic beers out there, which I think is a great substitute because you still get to enjoy it. It just doesn't alter your, your state of mind. This is what my friend said, which is, nobody just up and decides to do, crack or cocaine or something hard like that, or heroin. There's always a gateway to that. You have to already be compromised, which is very true, and that's the purpose of a gateway, which is why when you're fully recovered, you even have to replace the gateway. The best thing is God, counseling, family, therapy, and when you have a group, you need to stick with that group, and your recovery becomes dependent on each other. It becomes a support system. So that's my little story, and I'll kick it off into this is VIP News Radio episode number 2, but it's going to be episode 1 of a series on the doctors that help us, because quite frankly, it's impossible to do it without them, because there's a lot of things that have to be done. Anybody who's come completely through will have a very detailed story and will tell you there were many people that helped them. So it's worth, paying homage, paying respect to those people, and then also hopefully others who may be in the throes of addiction who are having trouble, or who know people who are having trouble, can point them to these resources so they can get the help that they need. There's a lot of sayings out there. We all go through DARE, which I think is a great program. When we're in grade school, probably don't appreciate it as much back then because you're really not exposed to temptations, or at least I wasn't. For me, it wasn't until I had a spine injury, which is actually, there's a large majority of people who their path towards addiction started that way. So I'm also going to pay homage to, I'll try to do a detailed coverage of different technologies. Spine surgeons are very, very special, unique group of people because they're the hand of God. It's quite magical what they can do. I know no pain like spine pain. And the trouble for patients frequently is that there is too many options and there's really no straight answer. The doctor can only show you the door, but you have to decide. So I'll share my story because I think it's a worthwhile one. I ended up with a double fusion. You probably can't see it, maybe a little bit. I have a small scar. It's done by Joseph Kim at Ortho, Virginia. Operates out of Bon Secours, St. Francis. So how that happened, because I put it off for 6-7 years as I was looking through different options. It was very, very close to getting an artificial disc. Really glad that I didn't. So the way that Joseph Kim put it is, those discs seem to perform really well in studies because they preserve motion. For a spine injury, it's the purpose is that it allows you to retain your range of motion without locking that segment of the joint into place. But the issue is that a lot of people don't see, that's not reported, is that it provides too much motion. So you get a lot of stress on the facet joints. And then actually all that extra motion can cause more pressure on the spinal nerves and even the spinal cord, because those discs are frequently more flexible than the original joint. So at any rate, I'm a big proponent of just, fusion. Of course, it's even just a fusion is not a basic. It requires surgical skill, everything about it. And I can't believe, going back to where I was before, I never thought that I would be where I am now. I take no pain medication at all, which I think is pretty rare for spinal injury patients. Usually once that starts, you're on something forever. So that's my story. The reason I started this is that I've reached pretty much a stasis with my recovery. It's about a year and 2 months since I had my surgery. And my story is a little bit different because when I was reading online, so a large contingent of the people who had suffered with spine pain, as soon as they wake up from surgery, their pain is either gone or significantly reduced. So I was using that as a barometer for my recovery, and was hoping, when I woke up, that I would know right away. And I suspect that that's part of other people's spine stories because of the fact that they're under anesthesia and local pain meds, Dilaudid, stuff like that. They give you the the PCM, personal, there's a self-actuated pain pump that you can use. So if they haven't been on painkillers prior, then just the fact that they've been put on those in order to go under and have the joint repaired would remove their pain. But so maybe it's that, and then when the pain meds wear off, they have to slowly recover in the same fashion that I did. But for me, I woke up and I was in exactly the same as much pain as I was before surgery. I didn't notice any difference for 30 days, actually. So I was sort of disappointed and thought that it was another, there's a lot of, you read online, there's a lot of stories of failed back surgery, and I would actually advise patients who are looking at back surgeries to not really read too much online. You have to trust the doctor. Trust the doctor, read the reviews, because online is self-selecting, most likely, a lot of the bad cases. So you sort of misreporting the results of these surgeries. Another part of the reason I want to tell my story, because it was a success, and I pay tribute to Dr. Kim and the team that got me up to that point. Image somewhere too, but I had a very large herniation at C6, C7 that was pressing on the spinal nerves, and the radiologist says it was, quote unquote, compromising the subarachnoid space. So, according to the axial images, it was sort of compressing the spinal cord to some extent. And that C5, C6, there was a large herniation too. Point is, it felt like there was like a very tight, grip around my neck, or a noose around my neck. Radiculopathy, tingling, numbness, shooting pains, hot and cold sensations, all kinds of stuff like that. Most people have heard of this with sciatica. It's very common in today's society. We're sitting at desks, and the sciatic nerves that go down your legs get pinched by a lumbar herniation. So I would suspect, I would like to, it's part of the reason I want to do this too, is I would like to have like a community of spine surgery patients, and talking about their experiences, and providing an outlet for people to talk about their stories, and for new patients to find a method of treatment that works for them. So yeah, that's kind of my story. So I'll get ready to kick it off into a little bit more detail. I'll make it a second video, but this sort of intro is to kick off the series. I'll go ahead and name the doctors that are going to be covered in this series. I'm calling them all Planted Clipboard members. So people who have followed my little path while I was under pain meds and going through God knows what, trying to reach stable ground. I created this sort of, I used to call it a brand, but now kind of like a program, which is Plant a Seed, Plant a Pet, Plant a Clipboard. This is one of my favorite things to do. Prior to having my injury, and when I was working a desk job for 7-10 years, was a pet rescue. So if you have very isolating type of job, it's one of the best things to do to get socialization, to get out and meet people. They're awesome communities, and all rescue communities are very social, very fun groups. They have a lot of events. Of course, there's a lot of pets. You can learn a lot about. If you're like me, I had no pets growing up. We were allowed to have one fish. My dad was allergic, so that we were, categorically denied having any kind of furry pets. I'm wearing the New York hat because it's paying homage to my paternal family history. My dad's side, from Albany, New York, there were a lot of men who were hunters and fishermen, and had hunting dogs and would hunt for deer, and had hunting cabins on the Hudson. So was exposed to that a little bit as a youngster, but down here in Virginia, that was never really an option. So I guess having pets is the one thing that I allow myself to do to be a little bit into that world. Maybe sometime I'll get a hunting dog. I have a few favorites picked out. But at any rate, kick it off. So this is the Plant a Clipboard certified doctors list. And what I want to do is anybody who has a question about spinal pain and spine surgery, go ahead and click that like button. I'm not sure where it's going to show up, and subscribe. And if you put something in the comments box, then I'll be able to reply with resources for you. And another thing that I'm hoping to do, I'm hoping to get some ad revenue from this that I can put into a nonprofit organization. I've been talking about this for weeks, and I think people have been wondering what it's gonna what it's going to entail and when it's going to materialize. But here it is. And so it's going to be owned by an organization called Pets Planting Seeds. It's just so happened to issue on my birthday. So that way, all the intellectual property is just owned by what I will hope to be a nonprofit organization. That way, it's known that the finances are being used for a good cause, and for recovery. I have a lot of creative ideas for what I want to do, because I think it can be sort of tricky to get people from substances into a sort of straight edge, clean environment. So you sort of have to, same way that there's like gateway drugs to worse drugs, there's also gateway substances to clean substances. So clean gateways. I want to develop some of those. So I have some ideas for that. But all right, so to kick it off, this is my Plant a Clipboard members, roughly in order of appearance since when I had my injury. It's Dr. Natalia Kalo, Integrated Neurology Services in Fairfax. She got me on some of the best pain medications that I was able to get to at the time. When I first had my injury, I went to emergency care, patient first, stuff like that, and was given a lot of um, immediate reaction, short term stuff like Ativan, um, a little bit of opiates, stuff like that, tramadol. These things don't, they're meant to be temporary. Doctors know this, but a lot of patients don't, so they might use it as a crutch for too long. She put me on duloxetine, which is the first thing that actually worked for my pain, and I was on that for many years. So tip of the cap to Natalia Kalo. It's called integrated neurology because they also specialize in sleep. So I'm intending to go up there and do another sleep study, actually, just to make sure that I've optimized that. I'm doing really well. I would say I've had a 99% recovery, but I'm still trying to fine tune a few things. Next person for planning clipboard is Timothy Z of One Medical Group. He's a primary care, and their practice is unique because it's very large. Most primary cares aren't that way. When I was in the DC area, so I found it really useful to be part of a large practice because regardless of where I was, DC, Maryland, Virginia, Alexandria, Arlington, they had locations everywhere. So if Tim's schedule just didn't match up with mine, I could go see a PA, in DC, which I did, and they had all of my chart and everything. So they saw me after my injury. I think one of the PAs gave me steroids, which actually helped a lot too, right after the injury. Of course, that's temporary as well. Next, moving on, Dr. Andrew Kolb, patient first. That's in Richmond, Virginia. He's fantastic primary. His scope of knowledge is very wide. I've been to him for quite a variety of different things, and he always has very good, thorough answers. And I've even gone with things that I just didn't really know any path, even after Googling, and he always has something. So big tip of the cap to Andrew Kolb. I think he's become like a regional director of some sort. When I first saw him in 2012, he was at a location in Chester, but now he spends more time up in Henrico, Short Pump area. Another one, Dr. Brian Subak. He is a dual board certified brain and spine surgeon. First saw him at Virginia Spine Institute. This is up in Northern Virginia area. They're well known for being, premier spine surgery practice. So you've got multiple doctors with multiple approaches and modalities. Very, very well run practice. I thought for certain I was going to be having my surgery with them just because of the relationship that I created with their practice and where I was at the time. But it's actually weird the way the timing worked out. It was like 2016. We changed administrations here in the U.S. and I lost my healthcare coverage. So I was without health insurance for quite a time, and certainly couldn't pay for a spine surgery out of pocket. And then in that time, actually, Dr. Subak had transferred from Virginia Spine Institute to National Spine and Pain, which I'll talk about in some detail because they cover a lot of procedures for pain. Very good practice, very large practice. Probably have more than a dozen or 2 dozen locations. So if you have pain issues, you're gonna want to start there. They have a ton of stuff. I'll just say that. while I'm to touch on Dr. Subak, he dual board certified, which is pretty unique in the spine surgery field. And a lot of people will say this when you kind of start getting into cervical surgery, cervical's neck. People will say different things, and you'll hear a lot of stuff if it's something you take seriously and you spend endless amounts of time researching. Like people will say, for thoracic and lumbar, you should go to a orthopedic spine surgeon, and for cervical, you should go to a brain surgeon. I don't know, maybe. A brain surgeon might tell you that. Brian Zubak is both. But really, I think, my doctor, Joseph Kim, was an orthopedic surgeon. Very happy with my result. I think a lot of these guys can do it. I don't think any doctor is going to operate on you if they think it's not going to help you or it's going to make you worse. So the main thing is to just, I think, read the reviews, talk with the doctor, and they'll be honest with you, But I think maybe something to know at least is that, a board certified spine surgeon can operate on all three sections of the spine, but a brain surgeon probably can only operate on cervical. I don't know that, unless they have a spine surgery fellowship. I'm not sure how that works, but it's worth looking into. So Dr. Subak, great guy, great practice, loves spine and pain. Another thing about that is that you have good continuity of care because, as far as I know, he's their first, possibly only spine surgeon. That way they're not referring out. So when people come in with, if you have a spine pain, you're going to go through, we all know this, you're going to go through from A through Z with before they actually do surgery, you have to try everything. Unless you're in like a car accident, need an emergency fusion, that's different. And I actually ended up in the ER because I was losing my mind with pain. Not a good place to go if you have spine pain, unless it's a car accident, because they're not really going to treat it. So definitely worth seeing. You're probably going to be seeing a couple different surgeons before you have yours, I would think, unless you already know them in advance or have a friend who had one operation done in advance and you're ready. But back to that topic of the treatment modalities that you have to exhaust before having your surgery. They typically are going to want to walk you through all of the required basics. So physical therapy, corticosteroid injections, like epidural steroids, nerve blocks. You can even do acupuncture, dry needling, stuff like that. Some people like chiropractors. I don't, just because of issues I had. And I've actually heard, this is what I've heard. This is the logic on chiropractor that is accepted by many people who have had an injury caused by a chiropractor. Chiropractors are probably a good modality for thoracic to lumbar, but with the neck, it's a little bit too sensitive. The most common problem that will be caused is known as a dissected vertebral artery. Typically happens with older patients. I actually have a family member who is one of the cousins on my dad's side who was an ultra marathoner, Iron Woman, very good shape, went to a chiropractor regularly, had a neck adjustment, had a dissected vertebral artery, which causes you to have a stroke. It splits the artery in half. So a lot of people don't know that the vertebrae that support your neck or support your head and your neck, the arteries actually go sort of inside these little facets in the vertebrae. So if you have the chiropractic adjustments that most people refer to are called high velocity adjustments. There's other techniques like the Graston technique, low velocity stuff, which is basically like a massage. I always support that. I'm a big proponent of massage. That's something I'm trying to look into more in a service that hopefully I can provide at some point. Really good way at healing stress, and probably preventing further injury. Definitely a very good modality. Yeah. There's a lot of places. They seem to be more prevalent in Northern Virginia, just I guess because there's a lot of pedestrian commuters, a lot of people working long desk hours. So like there are places in Crystal City Mall, Pentagon City Mall, where you can literally be walking to the metro or home from the metro through the food court, and they have little stations set up. There'll be a shop that has a full massage suite, and then they'll have those little kneeling chairs where they can just work on your neck and shoulders. I did that many times. I spent a lot of time and money doing that. Yeah, everybody's story will be different, but so back to all those treatment modalities. Massage, physical therapy, epidural steroids, nerve blocks, pain meds, steroids, stuff like that. And then generally at that point, once you start, if you're still talking to surgeons, that's when they'll be more serious about considering an operation. It's safer for them because you've tried everything, and also it's more likely that they'll be able to help you because they know that you've done everything else. I guess this, I always kind of remember the very memorable quotes that people say to us that guide our life decisions. And I went to this guy in Northern Virginia who said he was retired at the time, retired from surgery, and ran basically a referral orthopedic practice, and had a physical therapy service. And he said when he was a practicing spine surgeon, that his, because it's an area that's so sensitive and, it's probably unclear in many incidences, somebody still has pain afterwards, people will try to sue the doctor and say that the doctor made it worse, which I think is probably very rarely, if never, the case. But spine pain is so complicated that people will try to go that route. I'd like to do a piece on that at some point because I at least know one doctor, Dr. Stephen Hughes. I guess I didn't list him. I'll add him to my list. Specializes in malpractice. To quickly touch on that, generally the standard is what would a ordinary doctor do in that circumstance, and if the medical decision or medical procedure done is something that an ordinary doctor would recommend, then it's not considered malpractice. It's a pretty easy standard, I think. And I think most of the time these cases are just brought probably because of insurance, I would think, subrogation, stuff like that. But anyways, I think, to be a board certified spine surgeon takes a lot, and those guys know what they're doing. So yeah, back to Dr. Bruno. He said, he got to the point where he would tell me, he was like, I'm not putting a finger on someone's spine until they're begging for their life. Interesting way to put it. But as a patient, it's something that you really understand. And so that was the standard that I followed until I had my surgery. So I tried every other modality until I knew and the surgeon knew that it was 100% home run, which it was. So at any rate, I'm almost through all the modalities here. We're at 35 minutes. The last modality, which will probably take up a whole video, is regenerative therapy, Regenix, and stem cell arts, stem cell injections. Very, very large topic. Cover that in a whole separate video. But that's the, well, we got a couple other doctors on here for plant to clipboard. We also have while we're on Regenix, I'll touch on two of them there. Dr. Centeno, who invented stem cell therapy. Didn't invent the stem cell, of course, but invented orthopedic therapy using stem cells. So they're using it for many things now. I hope to interview them at some point. That could be a very helpful way of getting publicity and getting some revenue. They have a lot of videos online. If you YouTube or Google stem cell arts, Dr. Centeno, Regenix, it's their network of labs. I think there's about 50 practices that they partner with, and they license their technology to those labs. So typically if you go somewhere else, I went to several other practices. I was trying to save money. So I went to several practices that offered stem cell injections. And it was, I can tell you from experience, it was nothing like what I got from stem cell arts, not even close. You could feel the difference. Don't even waste your money on the other ones. Just go to Regenix. They have a patent on the technology. So when you go to other local practices, they'll have a small, they call it the bedside centrifuge. It's about the size of a small inkjet printer. That it's a centrifuge, so they'll take some blood out of your arm and spin it and take the platelets off of it. But in Regenix, all of their locations have a full lab, with, it's a, 200 square foot, 150 to 200 square foot room with, lab equipment and hoods and people with lab coats on, where they, it takes about 2 hours after what they do is they'll schedule a blood draw and then a table time. So they'll take your blood out in the morning, and there's actually recommendations as far as what to eat and what not to eat, and how to hydrate the day before. And then you have the blood draw in the morning, and then they process everybody's blood in morning and late morning, and then you come back for your table time where you'll get your injections. And again, I hope to interview them, talk more about the other procedures they do, because I've only done ankle, shoulder, neck, of course. I think that's it. They've touched up places here and there, but the stuff is absolutely incredible. First thing I had an ankle sprain, a grade 2.5, almost complete tear, that I limped on for 3 years. And I did everything, steroid injections. I did PRP and stem cell injections through another practice that wasn't Regenix. Helped a little bit, but it's completely healed now because of stem cell arts. That was the first thing that really proved it to me. All right, so I gotta get through all this list, playing the clipboard. Moving down, we have Dr. Paul Spector in Richmond has been very helpful with me on not really just pain medications, but sleep medications has been a horrible issue for me. I've had to take a large variety of different things to try to be able to sleep with my pain. Um, and he's gotten it down to from 4 different medications down to 1. Um, and I think he's the only triple board certified doctor I've ever seen. If I recall, his spine surgery, psychiatry, and addiction medicine. Um, and when you go to him, he's the only one who he has a unique approach. Most doctors nowadays that are in these large practices are doing like 15, 20-minute appointments. He's a rare gem because he'll sit down and do like a full approach, 45 minutes or so in order to help adjust your meds. Very, very awesome guy. I've was trying a lot to get some more fast acting pain meds for my sleep. Stuff that's harder to get off of, but he's stuck to his guns and kept me on the long acting stuff and suggested things I hadn't considered, and it's been great. I've been like reaching a foundation that I didn't think I would be able to get to. I'm not reaching for my DOP kit, my pain bag throughout the day. Just one medication. And then already talked about Steve Hughes a little bit. He's a surgeon for Ortho Virginia. I think it's still their name. Some of these practices have merged. It used to be Commonwealth Orthopedic, I believe. He's in Northern Virginia. They were paired up with the Redskins or the Commanders. They were the partner surgeons for them. So, obviously if the pro athletes will go to them, they know what they're doing, and they're getting a lot of experience. So he, I think, is a really good one to go to for spine surgery, because he was one of the first ones that told me that he only does fusions. He said that in so many words. It wasn't that explicit, but he was very hesitant with artificial discs. Whereas a lot of these guys, especially when this is the way I put it after going to many of them, is that at the front of their career, there's a lot of artificial discs because of marketing. At the back end of the career, there's a lot of fusions because they're having to take out a lot of the artificial discs that they put in and fuse those joints. And so like when I went to Joseph Kim, he was very explicit saying that they did a study about artificial disc versus fusion. They had a conference for spine surgeons where they asked surgeons to look at pathology of a patient and then recommend a treatment option, whether artificial disc, it's known as an ADR, artificial disc replacement, or fusion, ACDF, anterior cervical disc fusion for the neck. And the majority of them said ADR, artificial disc. And then they asked the same question, so what would you do if you were the patient? And the majority of them said ACDF, or fusion. So it's interesting because, without knowing it, the doctors kind of uncovered, it's like, well, the marketing really pushes this, and they would love to have, your patients would love to have flexibility, and your patients want that option. But the doctors who really know that long-term results, they know that it's fusion, because you don't have to touch that joint again. It's one and done. So I thought that was really interesting, that study. So Steve Hughes was the first guy that recommended a fusion to me, and it just so happened that I wasn't in Northern Virginia anymore when I had it happen. But I actually have a friend who he operated on my friend's lower back with great success. So great surgeon, great practice. Another one, Dr. Jed Ben Ichkachorn. It's a long name. A lot of people just call him Dr. Van, but he was with Tuckhoe Orthopedic in Richmond. Now I think they've been absorbed by Bon Secours. He does everything. I consulted with him, and we were very seriously considering a hybrid surgery. That was the procedure that I was almost certainly going to get, where they fuse the lower joint and put an ADR in the upper joint. It's called a hybrid. But I didn't end up going with that for a few reasons. There's complications with insurance. And I believe I would have had to have an artificial disc that I didn't want, because the artificial disc that I wanted, the M6C, wasn't approved for hybrid surgeries. That was the case. Hard to remember thinking back, but that was it. I wanted two M6Cs, now that I think of it. But he's also unique in that he does everything. He's done, fusions, ADRs, hybrids, but he also does a lot of other orthopedic surgeries. I've known people or seen patients with, like elbow surgeries, hand surgeries. He's really a jack of all trades. So really good practice. And the last one here, I think, on playing the clipboard, is Dr. Todd Landman of Beverly Hills Spine. I think he has a Florida location now as well. Didn't go to him in person for a consult, but did a video consult with him, and he really helped me, confirm that I needed a fusion or conclude on a fusion. He's widely regarded as one of the best spine surgeons in California. In the country. I think he I think did some of the FDA studies for the M6C. A lot of us who are looking for ADRs like the M6C, because it's the only disc that anatomically mimics a natural spinal disc. It has a outer Kevlar sleeve or something, which mimics the annulus, and then there's like a jelly donut, synthetic rubber material on the inside, which mimics the inner jelly portion of a spinal disc. So it compresses. It's the only artificial disc I know of that has axial compression, tension, and compression. All the other ones are basically ball pivot joints or sliding joints. And I'd like to open this up for comments, and people have had posting in the results or in the comments their results, because I've heard of a lot of people that have liked their artificial discs. So I'd like to hear long-term prospects of that, especially for people who are active, because I think that if you're very active and those last for a long time, that's notable. Just knowing that it puts a lot of stress on the kinetics of those discs when you have a lot of motion and movement. So I'll let that wrap it up, and then I'll move on to a video. I'll try to do a special focus for different medical topics for this series. But the next one I'll do is on stem cell arts and their procedures and Regenix, to try to cover as much of that as possible. But go ahead and like and subscribe. This is VIP News Radio. Remember, all profits go to Pets Planting Seeds. I'm very much hoping to have 501c3 nonprofit status. It's a shot in the dark. It's a moonshot, because you have to do it according to IRS regulations. You have to do it within 3 years of launching your LLC, or else they terminate your EIN number, your LLC. So please distribute, comment, offer suggestions for videos, resources for surgery, for spine surgery, addiction, medical services, stuff like that. Oh, I know, the last one I wanted to throw in is Dr. Nardone, great addiction doctor in Richmond. I know a lot of people who have gone to him and used Suboxone strips for pain/heroin addiction. Always say no to drugs. Always say no to street drugs in every single instance. Never, ever do it. Never. Always get a doctor. Sign up for Medicaid. Use your parents' insurance. Anything you can do. Do not go to the street. That's the biggest message, because it's only a path of misery and pain. All right, moving on. Hope you all have a wonderful day, and please hit like and subscribe. Thank you.